What is your personal story?
Ron?
Well, I was addicted to drugs and alcohol for about 10 years after having a fairly challenging career, and I was fairly high functioning before this hit. I ran some medical device companies and things like that, and then I was very ill for a long time. I sought all sorts of treatment, and it wasn't really until I was incarcerated for my third OUI when I, behind bars, received the treatment that I needed, and so it was a hard 4 months, but I wouldn't trade it for anything in the world because. I mean, I found my freedom in there, and I still have it, and I'm still enjoying it. I'm not an addicted person anymore. It's not there. And there's a very specific program and a proprietary program that was taught by a clinical counselor with 30 years of experience and using cognitive and dialectical behavior therapy, and it just works. And so it worked, and I'm good. And so I have, um, while in while I was incarcerated, I wrote a book as an alternative fellowship program based on what got me better, and now I've teamed up with this clinical counselor, and we're trying to share his program to the masses via technology, and so that we can get all these people better that are just suffering, because 175 people a day are dying over opioid overdose, and there's just millions that aren't getting any treatment at all, none, and they're just suffering, and it's out there. So we're going to try to find a way to bring it out, and God put this gentleman in my life, and just about 24 hours ago or 48 hours ago, and now here we are, teaming up, and um, and and he's a wonderful man. He's created an amazing company. And I don't want to steal his thunder, but your mission is to solve the opioid crisis, is to end it. That's mine too. So um, we're here now, and I'll shut up and I'll let you talk.
So, like Ron said, he went through a cycle of recovery. He's now a highly functional member of society. And he has gone through that entire cycle, and we are grateful that he's sharing his story with us, and he's getting that perspective that we were lacking at Opioid Help Center. Using that perspective, we are coming up with a solution that's going to truly transform public health and safety, especially around opioid usage. That's our story. So we all know the crisis of opioid. The numbers are there, they are screaming for attention. It's high time that we take care of this issue. It's not that there are not, it's not that companies are not looking at this issue and not addressing that issue. There are many organizations who are looking at this issue and solving the problem. But but the problem that we currently have is multiple organizations are looking at this issue from their individual mandate. So they are very good at fulfilling their individual mandate, but nobody has a common view of the opioid impacted individual. And if you don't have a common view of the opioid impacted individual, that individual is going to fall through the cracks and will not recover. And we are setting out to address that problem by creating the common view.
Awesome. Sounds good. So, talk to us about the team.
Well, the team is Deepak and myself, and I will let you talk about the remainder of the team because I don't know the members quite as well as you do.
There are a
So.
number of developers who are working with us. We have a roster of 6 plus. Um, we have already constructed our MVP, although we have started in February of 2018, just 2 months ago. So we have a MVP ready, and we are ready to share the demo with prospective customers. We have also reached out to a number of potential customers. To highlight few: Fairfax County in Virginia, some counties in Ohio.
Mm-hmm.
We are also working with Department of Public Health in Massachusetts. So right now we are actively engaging with the potential customers, trying to give them our trial membership
Oh, good.
so that we can get some feedback. That's where we are now.
Good. So you mainly mentioned different government organizations as your customers. Would you think there would be other potential customers that you would have, or no?
Yes, we do have non-governmental customers, potential customers as well, and some of them can be health plan providers like Blue Cross Blue Shields, Howard Pilgrim, and so on and so forth. Any healthcare program that has substance abuse aspect to it, they are our potential customers. Hospitals are our potential customers. In fact, I'm reaching out to some of the hospital folks who are attending this conference. I have few meetings with them, so the hospitals are potential customers, clinics are potential customers, NGOs who specialize in public health and welfare, they are also our potential customers. So right now, as I said, we are busy trying to get that trial membership handed out to these folks, and we'll get the feedback, and we are going to make our product even more solid.
Okay, great. And so, what is your vision for the next 2 years?
So our vision in terms of 2 years is twofold. One is the financial aspect of it. Another is the another is how effective are we in solving this opioid crisis. So let me talk about the effectiveness of our solution. Each customer with whom we engage, we will have a snapshot of where we started. Just to kind of give you an example, in state of Arkansas, there is a county called Independence County, and if they were to become our customers, we are going to start with the initial snapshot. This Independence County has a population of 37,000, and by the way, there have been 200 plus opioid deaths in this county. So we would start with that initial snapshot. We will roll out our program, and at every quarter, we are going to review what is the difference that we are making to that county. So that's how we plan to roll this program out, and we are going to do this per customer. Wherever we are going out, what's our snapshot before, what's our snapshot after. We are going to do this per customer, and that's our vision for next 2 years, and we are doing this so that we can become more effective, and we really solve this crisis. We are not here to make money, but money is also a key component, and that leads to my next part of this question, which is the financial vision. Where will we be 2 years down the line? Let me tell you where we will be in Q3 2019. We will have recurring revenue of 2 million plus based on our current product projections. So that's in nutshell where we will be few years down the line.
Oh, great. Thank you for telling us about your company, and we wish you the best of luck in the future.
Thank you so much. I appreciate it.